Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. And today, as always, is your opportunity to ask Dr. Arwady. Get your questions about COVID answered. Today is Tuesday, April 19, 2022. At this point, we are doing a once-a-week Facebook Live format, generally on Tuesdays at 11 a.m. So we will be back again, same time, same place next Tuesday. You can put your questions directly into the box below. You can also use the hashtag #AskDrArwady on either Facebook or Twitter. We've gotten a number of questions in about masks on transit. We've gotten questions about what's happening with variants. So I've put some slides together to highlight some of that. And as always, we will start with our Chicago data. If you go to chi.gov/COVID-, we continue to update this Monday through Friday. So first of all, when you go to the dashboard, you'll see right up at the top, this Chicago's COVID-19 risk level is low. We've got the low, medium, and high. You can click here if you want to learn more about the community levels. And you see right up at the top here, we highlighted that with Chicago Public Schools on spring break last week, there would be fewer test results reported and test positivity might temporarily increase over the next couple of weeks. And that generally test positivity, of course, has a somewhat reduced utility because we have widespread point of care and at-home tests. And so that's part of why the COVID-19 CDC's community levels don't rely on percent positivity. And so if we look at the numbers, we see that to be exactly true. Let's actually start down in the bottom right with positivity. It is 5.4%, which for those of you who pay attention might say, wow, that really jumped up a lot. And it did. It was 2.1% a week ago. And so that is more than double in a week. However, this is just a good reminder of how positivity fits into cases and tests performed. Because remember, positivity is the number of positive tests, cases, divided by the number of tests performed. And so always positivity is about how much are you testing, and that's really the main way we think about it. So if you look at tests performed here, you can see we're averaging a little bit under 10,000, and that's down 57% from the prior week. There's always a lag when these numbers are coming in, so it's reflecting what was coming in over the weekend and some of last week while we had a lot of schools on break. And so with a drop of 57% in tests, and you can see this if you zoom out, you can see that huge drop. That is with school testing being on hold. And so with that big drop of more than 50% in the denominator, we see an increase of about 50% in the positivity. So not a surprise. Cases continuing to go up, and they are up even a little bit more than what we would see here, again, because testing is down. But overall, the hospitalizations are the lowest they have ever been in COVID. We're averaging fewer than 5 new COVID-19 hospitalizations a day. That's even lower than they were last summer, lowest it's been since the beginning of the pandemic. Deaths, we're actually averaging 0 COVID deaths a day, and really just about 1 a week or so, which is also the lowest we have ever been. And this is reflecting, we are seeing more of these very mild cases, especially some breakthrough cases where people are asymptomatic or very mildly symptomatic and different than what we were seeing earlier in COVID. Vaccinations doing about 3,100 a day. So let's dive in to a few of your questions with some more slides here. So first of all, a lot of you watching what's happening internationally, and we are too. So still, we are seeing parts of Europe, Australia, New Zealand, parts of Asia, very, very much in the biggest surges that they have had. That continues to be the Omicron surge. It's the BA2 subset, if you will, of the Omicron surge driving that. But they are breaking all records. In fact, seeing higher cases per population than we saw here in the height of the Omicron surge. Some of that is because there are settings that we're aiming for a COVID-0 attempt. But the good news is that even though they are breaking records in many cases, in terms of case numbers, they're not seeing these major increases in hospitalizations or deaths, and that is because they generally have very good vaccination rates. So where you combine a lot of testing, which these settings have, just like we do here, with very high vaccination rates, you can see a lot of cases without it turning into serious illness or needing to have major mitigations put in place at the community level. We also are now over 2/3 2/3 of the world's population, 66.7%, have had at least that first dose of vaccine, and there have been more than 11 billion vaccine doses administered. We are seeing some slight case increases in other areas of the U.S. Some of you were writing in about this, but nothing that is causing alarm at this point. These are the states that are showing that have the highest rates right now, and you can see some of them are in the Northeast. Puerto Rico is on the increase again a little bit. But everything not turning into significant hospitalizations or deaths. On these graphs, the red is the cases, the yellow is the hospitalizations, and the gray is the deaths. So a little bit of increase in the hospitalizations. We may see, obviously those are lagging indicators, so they can come a little bit later. But nevertheless, nothing hugely concerning. Here's what's happening in New York City, which we've been watching closely. So as of couple days ago, they were averaging about 2,100, 2,200 cases a day, which is about 2.5 times what they were averaging in March. So very similar to what we're seeing here. But that rate of increase is quite similar to what we're seeing in Chicago. Nothing consistent with the huge spike. Remember that at this point, if people were exposed to BA1, they are protected more than 90% against that BA2. And given how hard we were hit in Chicago with Omicron, the BA1 version, everything looks good that we're going to continue to escape sort of a major surge. If you look at cases per 100,000 population across the US, we look at this every week, and you can see again, the Northeast is having more cases. There's more testing that happens there, but also quite high vaccination rates. Illinois and Chicago are both a little bit above the national average in terms of cases per 100,000 population right now. You can see we're in that lightest orange up in Chicago. And let's remind you again about the CDC COVID-19 community levels. We are in low, and the community levels as defined by CDC, they really work to simplify these, which I think is good and important. I wish that this had been done very early in COVID just to help everybody be on the same page. But every community in the United States is classified as low, medium, or high. Low, which is what we are. We're seeing a limited impact on the healthcare system, low levels of severe illness. At medium, some impact on the healthcare system, more people with severe illness, and high potential for healthcare system strain and a high level of severe illness. If you go on our website, you'll see some of the details of recommendations here. For example, if and when we were to get to a medium community level, we would be making recommendations for masking again in indoor settings. Those masks do start to take effect right away when everybody puts them on. There are certain settings that almost certainly would be requiring them at a medium risk level. And then if we were to get to high, we would require masks in indoor settings. That's the current plan based on what we understand about COVID. Of course, if we were to see new variants, something really majorly change in this space, we could adjust, but this is really the way that we're thinking about it. And across the U.S., we are doing very well right now as a country. Again, some of this is because Omicron hit so hard. Nevertheless, just 6% of the counties in the U.S. are in medium or high risk, and that is down 4% from the previous week. You see there's some orange, really high risk up, especially in upstate New York. And then in Illinois, there's just one county right now, Champaign, that is in medium risk. Some of that is they also do a lot of testing there. But nevertheless, if you were to be in Champaign, I would recommend masking indoors while you are in that county. And let's talk a little bit about the numbers that underlie this again. So first of all, we look at new cases per 100,000 people in the last 7 days. Low is less than 200. Chicago is at 118. Cook County is right there at basically 119, 120. And then we look at based on what those cases are, if you're below or above 200, you then look at COVID-19 admissions per 100,000 population, as well as what percentage of your hospital beds are taken up by COVID patients. And those can be different. It's important to recognize here in Chicago that when we're talking about new COVID admissions per population, those are actually Chicago residents being hospitalized. So you see here, we have just 1.4 Chicago residents per 100,000 population being hospitalized every every week here. Low is less than 10. Again, this is the lowest we've been since the beginning of COVID. At Cook County, it's a little higher, but still at 4.4, very low. And then our proportion of staffed inpatient beds with COVID patients. This is not just Chicago residents, but recognizing that Chicago is, of course, a regional referral center for the Midwest, that sometimes the number of Chicago residents is not the same as the number of COVID patients that are taking up beds. But these two are very low. Low is considered less than 10%. Right now, 2.1% of our ICU beds, 2.3% of our non-ICU beds in Chicago hospitals occupied by patients either with diagnosed COVID or suspected COVID waiting for a test result, and across Cook County hospitals at 1.6%. So these really do look good. And just so you know, on the left there, this is the CDC.gov risk chart here. Remember, the first split, are we fewer than 200 or 200 or more? If you're at 200 or more, you can't be low risk by definition. But if you're fewer than 200, as long as your admissions and your staffed inpatient beds are at less than 10%, you're considered low. If we were to get to 10 to 15% or 10 to 20 admissions per 100,000, we'd be medium. And then greater than 15% or greater than 20, that's when really the healthcare system is being seriously threatened. That's when it's really necessary that everything is in place to limit that risk. So we remain in low and pleased by that, but keeping an eye on this every day. And of course, continuing to follow all of the other metrics behind the scenes. This is what our COVID cases look like. Again, we're averaging 456 right now per day, up from 420 a week ago. You can see on the increase, but gentle. Again, more similar to what we saw with some of the smaller variants over the summer as opposed to the Omicron from last winter. And then I just did put a slide on here about positivity again, even though I mentioned it. So what's going on with positivity? It reflects changes in testing patterns. With CPS and other schools on spring break, reported tests, that's what's in the bottom right there, spring break, dropped more than 50% over the last week. Test positivity, which is positive tests divided by all tests, therefore more than doubled. As school testing returns this week, we do expect to see those testing numbers increase and our positivity decrease again by next week. So don't be surprised where you're looking this week. You're going to continue to see relatively high testing, but relatively high positivity, but know that that is in the context of the lower testing. As I said, fewer Chicagoans now being hospitalized with COVID than at any point in the pandemic. You can see what those numbers look like. We peaked January 4th of this year with over 300 Chicagoans newly hospitalized with COVID in one day. We're currently averaging fewer than 5. Also, fewer Chicagoans now dying with COVID. You can see that's down to just about 0. Really remarkable. Here's what our vaccination numbers look like. We continue to make progress every day. And there are people getting their first doses and their second doses every single day here in Chicago. Vaccination rate by age, all of this is on the dashboard if you want to take a look, but we are at now 53% of our 5 to 11-year-olds have had a first dose. 71% of those over 80, that's the one I really worry about. If you know anybody over 80, please, please, please make sure they're vaccinated. They're the most likely to get severely ill or die. But every other age group is now over 80%, which is great, and making progress on completed vaccine series. And by race ethnicity, still we are seeing Asian, non-Latinx Chicagoans be most likely to be vaccinated, with more than 85% of all ages, including those under 5 who haven't had a chance yet, have had at least that first dose. 76% of both Latino and white non-Latino Chicagoans have had at least that first dose, and about 62% of Black non-Latinx Chicagoans. So what's going on with mass on transit? I know people saw the news yesterday that there was a judge in Florida that overturned the federal mask requirement. I will tell you from 2 years of doing this that there can often be a lot of back and forth in the courts. We've sometimes seen overturning of vaccination requirements, which come back. So we're, of course, watching what's happening at the federal level, but I want to be clear that in Illinois, the governor's executive order 2122 does remain in place, and that order explicitly includes a requirement for universal masking on public transit and in public transit hubs. So that is in place through the end of the month at least, and then it may be extended or revised, but at least in the short term here, we are legally covered and masks do remain required on CTA. CDC also continues to recommend that people wear masks in indoor public transportation settings at this time. Both CTA and Metra have said masks are still required at this time. If it changes, they will notify. And there is the potential for some moving parts over this short time period on the legal front. But let's talk just for a second. Public transportation does remain one of the settings that is the least controlled. I took the L into work this morning and it was very full. I'm happy to see that because it means people are out and about and going to work and going to school, but I was definitely not able to keep 6 feet of distance. And frankly, everybody on my L car still had their mask on. And I was pleased to see that because someone was coughing over here, and it does make me feel a little more comfortable just knowing that it's a setting that is required. Many people have to take public transportation to get to work, to get to school, et cetera. We are, of course, at low risk as a community, but I think especially when these changes come very suddenly, they can be confusing for people. And so I am very glad. And our strong recommendation was to keep that requirement, at least in the short term here, in place. So I am fully, and CDPH is fully in support of keeping the masks on CTA and Metra, certainly while the governor's order remains in place through the end of the month. And then we'll be assessing what happens after that. I plan to keep my mask on sort of indefinitely. I think it's a nice way to show my care for others, and it does help me feel more comfortable when I'm commuting in the morning. And to that point, if you see someone choosing to wear a mask, even while it's not required across Chicago, please remember there's a lot of reasons people might be doing that. Autoimmune condition, high-risk loved ones, unvaccinated children, they themselves may be unvaccinated, may prefer to wear a mask. Generally we've seen folks in Chicago be very kind and respectful of everyone's choice. I've been pleased by that. Please keep that up. When people wear a mask, it does help decrease risk for everybody. Let's talk about variants now. So we are seeing the Omicron BA.2 subvariant increase across the Midwest now and here in Chicago. We continue to see it doubling about every 7 days. And so about 84% now of the cases are Omicron BA.2, and the remainder 16% are the original BA.1, B1.1. That's really all we're seeing. We're not seeing Delta. We're not seeing anything else. You can see in the light purple there, or the pink on the left, each week we've seen BA.2 outcompete B1. The Midwest is still a little bit behind the rest of the U.S. here. You can see the U.S. overall is about 86% BA.2, and up in the Northeast, which is where cases are the highest, where the biggest, not a huge surge, but that is where we are seeing the highest case counts and the biggest increases. You can see some of that is because they're at over 90% now in that light pink color with the BA.2. And so I do expect, probably still for the next few weeks, while we continue to see BA.2 outcompete the original Omicron, I do think we'll continue to see some increase in numbers here, but nothing at this point is making me concerned for a huge surge. And we were getting some questions just about what's happening with some of these other recombinant variants, and I thought I'd just take 1 second on the science here. So yes, there have been some what we call recombinant variants, XE, XD, XF, but let me tell you again, there have been no new variants of concern identified. We continue to monitor the way the virus changes and evolves every day. We do that here in Chicago. We do that across the country. And so, yes, you probably will continue to hear about these new recombinant variants. XD and XF are a combination of some of the genetics of the Delta and the Omicron BA.1. XE is a mix of BA.1 and BA.2, and the majority from BA.2. But we're not seeing major differences in how it's growing. We don't have any sign that the vaccines are less effective. And overall, not a cause for alarm or major concern at this point. You can see on the right, most of these sequences have been detected in the UK, more than 1,200 of them, but they have been detected in countries around the world, about 10 or so of these recombinants in the US, one in Illinois, not in Chicago. There probably are more, though, but nothing at this point that, again, is raising a huge amount of concern. And I did think I'd take just a second here because a lot of you had questions about this. So we study the genetic relationships between different variants of SARS-CoV-2. It's like every time the virus changes, we look at how related is it to what came before. And so this is kind of like a family tree for SARS-CoV-2. And you can see each of those little dots are a variant, if you will, kind of SARS-CoV-2. And then the ones in the different colors are the ones that were different enough that they ended up being labeled variant of interest, variant of concern. And so you can see that basically the farther apart they are from each other. One limb of the tree over on the left there is Delta, and then down in the bottom rim you can see BA1 and BA2. They're a long way from the other variants that we've seen, but they're fairly close to each other. So the genomic epidemiologists do this kind of work, and this is why we know, for example, that BA2 is pretty similar to BA1, and that's part of why we're not seeing a lot of reinfection between BA1 and BA2, whereas Delta and BA1, BA2 were really pretty different, and that's some of why prior infection does not seem to hold up particularly well, especially against the Omicron variant. So this is some of the analysis that gets done. And also, the scientists look to see, are we replacing a lot of the existing diversity? And we are. We see, particularly with these Omicrons, the orange and the red coming in and just wiping everything else out. And especially Omicron, we see a lot of mutations at what's called S1. And you might have heard or read about S1, or the spike protein. There's a little picture down there on the right of what the SARS-CoV-2 virus that causes COVID looks like. And those red are the spikes. And the spikes are unique to the virus. Your body does not make these kinds of spikes. So vaccines tend to focus on the spikes. The spikes are how the virus actually attaches to our cells. They're very important. And one of the concerns about Omicron is that a lot of the mutations, a lot of the changes were in S1, which is one of the domains, one of the parts of that spike protein. And so you can see on this graph on the left here, it's showing how many S1 mutations, how many changes were there in all of the prior variants that came before. You can see in turquoise there, Delta, we were seeing 10, 11, 12, 15 mutations in S1, whereas Omicron, a big jump, and we were seeing more like 25, 30 different mutations. And that's worrisome, because it means that the virus is more easily able to evade the immune defenses and attach to our cells and get in there. So that's one of the reasons that Omicron is so much more infectious. And S1, really, in 2021, we saw it evolve and change really quickly. What actually happens is there's change in what's called the amino acids, which make up the protein. And so you can see that again, over time, this is showing the higher you go, the more changes you've had, the more mutations, the more amino acid substitutions, specifically in spike S1. And they'd been growing at a pretty steady rate. And then you see with Omicron there, they took a big increase up and a lot of changes. And that's part of why Omicron was so different. And that change is really fast relative to seasonal influenza. So you see on the bottom three here, again, that black line shows you over years how quickly do we usually see the influenza virus change. And up in the upper left, we see SARS-CoV-2 in the spike virus much steeper, over just a couple of years having many, many more changes. And this has been one of the challenges, that faster than influenza, SARS-CoV-2 continues to mutate. And that's some of the conversation about whether there may be a new vaccine potentially in the fall that is more specifically made to attack some of the changes, some of the variants. All right, finally, we had a paper published in Emerging Infectious Diseases. These are a lot of authors from the Chicago Department of Public Health and from the CDC that was looking actually at our very first Omicron cases here. And I'm just highlighting it because it shows a lot of the new genomic capacity that we have. So basically, the first confirmed Omicron case in Chicago and in Illinois was in someone who had attended a party here and had traveled really over Thanksgiving weekend. It was was fully vaccinated, but had attended a party at a large bar. and there was a dinner in an event space, and we ended up investigating this outbreak, not just who was at the bar or who was at the event space, but reached out to other individuals who lived across different states who had been at some of these events or were potentially linked, and didn't just ask, were you at the bar, were you at the party, were you in contact, but actually did some of the genetic sequencing. And so we were able to show that, in fact, not only were these all the new Omicron, what figure B is showing on the right there, it shows like each of those lines is one mutation. If you don't see a lot of mutation, you know that they're probably from a single source. And so we were able to really do this multi-state investigation and sequence to show that, yes, this was not just, that this was spread of Omicron in a pretty vaccinated young population, which already showed us this was something a little bit different, but that also that this was clearly where spread was coming from. And it is the ability to pair the traditional outbreak investigation with more of the sequencing that lets us understand more. And we continue to use this when we see outbreak situations in Chicago. We do additional genomic sequencing so that we can better understand how cases are and are not linked. Finally, we launched One Chai Fam this last week. If you or someone you know is a parent of a newborn in Chicago, if you go to onechaifam.org, this was launched partly for Black Maternal Health Week last week, and it highlights a lot of the resources available to anybody raising an infant and a young child here in Chicago specifically. So it's a really nice site. It's also part of our Family Connects program, where we have a goal of having actually a nurse home visiting to every baby born in the city of Chicago, and we've already launched that in conjunction with 4 of our birthing hospitals, and working to roll that out more, recognizing that more than 90% of Chicago families have some unmet need in the few weeks after a new baby is born. So I encourage you to check out onechaifam.org if you're interested in some of that work that the health department and partners are doing. And then finally, just highlight that in addition to me continuing to do Facebook Live on Tuesdays, Dr. Luna doing a Spanish version on Wednesdays, Dr. Erica Taylor, who is another medical director at CDPH, is starting on Instagram Live something we're calling Dr. Taylor's Table. She's going to be doing this at 6 p.m. every other Thursday. And really, this is going to be longer term, focused on health and wellness and community, also racial equity, particularly with a focus for Black Chicagoans, though of course open to all. And so the first Dr. Taylor's Table will be live on Instagram this Thursday at 6 p.m. So I encourage you to check that out at Chai Public Health. Please follow us as we continue to really think about developing content. I plan to continue to do this Facebook indefinitely, even when it's not around COVID, just because it's been helpful for me to hear what questions people have about public health and to highlight for many of you the work that we're doing. As always, 7 days a week, chai.gov/COVIDvax or 312-746-4835. Let's get into some more of your direct questions now. Okay, so a number of you are writing in about mask questions on public transit. Not a surprise. Kristen Korkowski on Facebook is asking, how do you feel about masks on public transit? Francie Swidler from Facebook, do you need to wear a mask at O'Hare? Does that fall under the governor's order, or is TSA in charge? Andrew says, do you think the mask change was motivated by science or politics? What advice would you give travelers and commuters about wearing masks? And then I do just want to comment, I see Diana Lynn on Facebook here saying, happy there's no more masks on planes, COVID is done. So COVID is not done, just to be clear. But I do think, I will say, first of all, and you got a sense of my opinion on this when I was doing the presentation, that I want to make sure people feel reasonably comfortable taking public transit. I think it is so essential to our lifeblood as a city. It's how people, including myself, get to and from work every day. It's how many of our students get to and from school. And like I said, it can be one of the least controlled settings. So I think we will see how this plays out in the legal process over the next few weeks. Like I said, in the short term here, we are covered by the governor's order. I feel like, certainly if we were to get to a yellow point, this would be something that, we would definitely be wanting everybody wearing a mask. But at the moment, I am glad that this remains in place. I think it's important that we also have the opportunity to actually communicate and explain to folks. Do I think it was motivated by science or politics? I think there have been a lot of very interesting legal challenges to things that have been in place, that have been put in place primarily with a science bent. So the CDC, of course, continues to recommend masks in transit. They had extended, the plan had been to extend for another couple of weeks, if folks were not aware of that, just given the increases that we're seeing in the Northeast and the recognition that they can be less controlled spaces. So I think it's I don't know that it's driven by sort of science versus politics. There are obviously strong feelings. I do think the good thing is that as a country, I'm very glad that we have the low, medium, and high risk, because my expectation would be that in, certainly high and really ideally medium, you would actually be having the mask in those settings. And so, for me, the risk is different in different local places. And that's one of the things that probably will be incorporated moving forward. So the advice that I would give is to continue wearing a mask, frankly. And certainly here in Chicago, if you're on CTA, most people, I think, especially in the short term, it is required at this point. But I also think, I just feel a lot more comfortable when I hear somebody coughing, knowing that everybody has one on. And I intend to continue to wear it. I think the airport space is a little bit under consideration right now. It is still covered under the governor's order. So like through the end of the month, legally, the transit hubs, including airports, are covered there. Obviously, we've been in conversations with the Department of Aviation. They've been in conversations with airports across the country. But I would encourage you, if you're traveling, certainly over these next couple of weeks, I would default to wearing the mask, because there may be a little bit of a patchwork while the country gets caught up. But right now, masks remain required on transit in Chicago and in Illinois. Lisa Pataki Marth on Facebook says, what are your thoughts on no masks on airplanes? I'm flying this week and not certain I'm ready to remove the mask. Right. So we did see most of the airlines, with the lifting from TSA, the airlines are not going to be enforcing the mask requirement. And there is a difference between recommendation, requirement, and enforcement. I would wear a mask if I were flying. I did fly last week, and I definitely wore a mask, as did everybody. Of course, it was still required. I would wear, especially if you're feeling a little bit nervous about it, I would just wear a KN95. That gives you some additional protection. But know that probably everybody will not be wearing a mask. And my biggest hope is that things will stay, that again, people will be kind where there are folks wearing masks. And I do think a lot of people will wear them in the short term. Okay. Mary Rodriguez on Facebook says, I was reading that we are following Europe's lead, paying less attention to stats on COVID cases, more attention to numbers on hospitalizations, and that looking at data in the same way we've been accustomed to over the past 2 years can be misleading, since situations are different with vaccine widely available. Has our risk matrix changed? Yeah, that's a really good question, Mary. So you are correct that broadly speaking, we have switched, not just here in Chicago, but really with CDC's guidance, there has been change across the whole country. And one of the reasons I showed you that CDC risk matrix is because that is the main one that we're using. So it still looks at cases per population. That hasn't gone away, but it puts an additional emphasis on how many patients with COVID are being newly hospitalized, as well as what percentage of hospital beds have COVID. And it is a different situation. And so you've noticed we're not putting up that old risk matrix in the same way, not highlighting it as much. The numbers are all still there. We're all still following them. And we continue to look at emergency department visits and all the other indicators. But in terms of making decisions, New York, Los Angeles, really almost all of the large cities across the U.S. are following these CDC metrics and guidelines. And we feel comfortable to act on them if necessary. Again, we get a new variant, some major change, it may need to alter. But you're right that a COVID case that does not result in serious illness is not the same as what COVID looked like in the beginning of March. And so we have continued to evolve. Protecting the health system has been the primary need all along. Karen Nathan Sussman from Facebook. Can you speak to the benefit of one-way masking versus two-way masking and the protection difference for those more at risk when those masked are around those that are unmasked? Yeah, that's another good question. So it is true that the best benefit comes when everybody is masked. The most important thing your mask does is give source control. That's why we continue to emphasize that everybody, must wear a mask if they have been exposed to COVID. Certainly if they have potential symptoms with COVID, you have a cold, the flu, you're not sure, please wear a mask. It helps limit that spread, and that keeping your germs to yourself is the most important thing. But the one-way masking with the higher quality mask, like the KN95 mask, does give additional protection. I think, when you are wearing a mask that's just the cloth mask or the lower quality and others around you are not, you're probably not getting that much additional protection. You are getting some, and maybe next week we'll bring back some of, I always like to show people some of those original studies looking at the different types of masks and the source control versus what was coming in. So I would say that as fewer people may be universally masking, for folks who are more concerned, I generally will put the KN95 on. I have some that fit and are reasonably comfortable, but that's what I would say more broadly. Having everybody masked does lower the risk even more. So. And finally, as the last question here, for what we've got time for, and there are questions we didn't get time for, Colin Parsons from Facebook says, it's been over 2 years. How many more questions are there? It's been over 2 years, but people keep having questions. We keep learning more. I am really committed to continue doing this as long as there are questions, and there are. We get a lot of them, including outside of this Facebook Live. So it's enough to keep us coming back each week. If we didn't get to yours today, we will be back next week. Please stay up to date with your vaccines. Get a booster if you're due for one and you haven't. IDPH is actually going to be sending out, so the Illinois Department of Public Health is going to be sending out some text messages to people who, per their records, are not up to date with their vaccines, have not had a second dose, or are perhaps due for a booster and haven't had one. So if you get one of those texts, there will be some information for where you can go to check your records or bring them up to date if needed. But more importantly, do come up to date. It's the most important thing. While there continues to be a lot of worry and conversations about masking and everything else, it is the fact that many people are fully vaccinated and up to date that is turning this disease into something that we have the lowest hospitalizations and deaths ever in for Chicago. So I love where we are. We're keeping a close eye on it. We'll be back next week. In the meantime, please continue to be well. Keep that mask on public transit, and we'll see you next Tuesday. Have a good week.